Morning, everyone. Can everybody hear me? All right, I'll try to project. It's an honor to be here today with the Emergency Nurses Association, representing 35,000 emergency physicians who are part of the American College of Emergency Physicians. That's my daughter. As you know, healthcare workers are more likely to be victims of workplace violence than in any other profession. We work in the most violent, non-law enforcement industry in America. This violence can take many forms, including verbal abuse, physical assault, sexual assault, online harassment, stalking, and even murder. I'm an emergency physician, and I have been a victim of both verbal assault and physical battery multiple times. I've been called unspeakable names, threatened with harm, branded a racist, manipulated by real-time threats of frivolous malpractice lawsuits, and threatened with false reporting to medical licensing boards. I've been chased through the ER and forced to hide behind a door, and I've had someone spit in my face. Each of these incidents has been perpetrated by a different patient, and all of them have happened just this year. In the past, I've pressed charges against a patient who hit me in the face with a phone. 4 years ago, I did the same against a patient who planned to return to the emergency department and shoot me and the nurse, and we weren't even the people taking care of him. Unfortunately, this violence has had a profoundly negative impact, of my opinion, of healthcare as a profession, and it has drastically impacted my ability to empathize with my patients. Tragically, I can't help but discourage my 5-year-old son when he tells everyone that he wants to be a doctor like Daddy when he grows up. That breaks my heart, and it makes me angry. I decided to be a doctor when I was only 5 years old myself. This job was supposed to be better than this. I wasn't warned about this in medical school. I am certainly not alone. Among doctors, 50% of emergency physicians report being physically assaulted by a patient, yet only 3% ended up pressing charges. We all know the barriers that are involved with that. All of this that we talked about today has been made far worse by the COVID-19 pandemic. It's caused our healthcare delivery capabilities and our society in general to nearly fall apart. The pandemic and its sequelae caused not only the well-publicized loss of over 100,000 nurses from our workforce, but also 130,000 physicians. A survey recently showed that 1 in 5 physicians in the United States plans to leave their practice in the next 2 years, if able. Our system is truly on the brink. The time to stand up and demand change is now. We need to take action to address the problem of workplace violence in emergency medicine and in the entire house of medicine. We need to create a culture of safety in our hospitals so that these places, once regarded as safe havens and houses of healing for our patients, can perhaps begin to heal themselves. When caregivers go to work, they should be able to focus on the task of caring for the sick and injured, not worry about they themselves becoming injured. Physicians and nurses must be provided with the leadership support and resources needed to be kept safe at work. Each hospital must be required to implement workplace violence protection programs to keep us safe from harm. And when attacks do occur, and they will, administrators and executives should treat nurses and doctors as their most prized assets and support them fully as they navigate the complicated legal and medical fallout. And the fear of retaliation from our supervisors must end. Hospitals must also provide adequate, capable, and well-trained security officers where needed, not only to physically protect us, but also to help ensure that victims are taken seriously by police when attempting to file criminal charges. Also, emergency department boarding needs to be addressed as a contributing cause. Hospitals need to invest to increase capacity and capabilities in our emergency departments as our population continues to grow, while access to non-emergency care continues to shrink. Otherwise, we truly risk disaster. But let's be realistic. Healthcare companies and hospitals will not do enough unless they are forced to. Otherwise, they would have done it by now. That is why the Joint Commission created new requirements addressing workplace violence in 2022. However, it's important to question whether these requirements are being followed and whether there's any real recourse if they're not. That is why federal legislation is before our elected officials. Some states, like California, have been successful in their endeavors and have enacted statewide laws requiring workplace violence programs. However, we cannot wait another 20 years for each individual state to pass disparate laws complicated by politics while nurses and doctors are being assaulted and patient care is being affected by a contracting and burned out workforce. That is why we are here this week, to encourage our congressional representatives to pass legislation that is currently before them. Specifically, we urge them to pass the Workplace Violence Prevention for Healthcare and Social Services Workers Act, which will empower OSHA to require employers to develop and implement comprehensive workplace violence protection programs that are worker-driven. It's crucial that perpetrators of violence be held accountable for their actions. For that reason, Congress should also pass the Bipartisan Safety from Violence for Healthcare Employees Act, which would make assaulting or intimidating a healthcare worker on the job a federal offense, like flight attendants, postal workers, and IRS agents. We healthcare workers fought on the front lines of the COVID-19 pandemic for years. We risked our lives to save others. We slept in our basements. We isolated from our children. We lived in constant fear that we would bring home this illness to our families while others were safe locked down at home. We answered the call. Now it's time for Congress to show that we are valued. Make us a protected class of employees and make our workplaces safer for us and our patients. Passing these bills will provide much-needed resources to help prevent, mitigate, and respond to workplace violence in healthcare settings. They will also send a clear message that violence against healthcare workers will not be tolerated. Lawmakers who support these bills can show that they understand the serious healthcare workforce crisis that is happening right here in America, and that action must be taken now to reduce the burnout we are all experiencing in order to slow the ongoing exodus from nursing and the practice of medicine. I urge the media, share our stories. I urge you, contact your elected officials and tell them to support these important bills. Now, perhaps more than ever in American history, we must demand courageous leadership from our elected officials. Our patients deserve the best care that we can provide. Please give us the protections and the tools we need to be able to do so. Thank you.